Sarah, so good to see you. Thank you so much for inviting me to your house. It's always good to see you. My, have you changed? I know my appearance has changed over the years. It's been hard to go out in public when people point and laugh me. You see, I have a genetically abnormality called Turner syndrome. Turner syndrome? I've never heard of that before. What is it and how long have you had it? I've had it my whole life. It's a genetic defect that occurs. First, you need to understand how genes work. Everybody has 46 chromosomes to make a pair of 23. This includes a pair of sex chromosomes, X and Y. The X and Y pairing determine what our gender will be. Men have the XY pair while women have the XX pairing. An abnormality in the genes can be manifested as a deformity in the body. I've heard of genetic defects before, like cystic fibrosis and Down syndrome. But how do these genes get harmed? That's a great question. We get half of our genes from each parent. 23 in the egg and 23 in the sperm. They combine to give us 46 chromosomes. We also have a pair of sex genes that determine our gender. During meiosis, these pair of chromosomes split. Sometimes this splitting doesn't occur. This means one oocyte or sperm will have one too many sex chromosomes and another one will be short one. If the one that is short one gets fertilized by set that halves one, then it leads to the condition I have. Turner syndrome. I see. So I have the pair of sex genes but you only have one. That's right. I only have a single X. All women, like I mentioned, of 2X because I'm missing one. I now have structural and endocrine abnormalities. Sarah, I'm sorry that you have these problems. I've noticed that you have a different physical appearance than most. Thanks for being so kind. It's been hard having these abnormalities. Most girls just point and laugh at me. You have always been nice. Thanks for being such a good friend. Well, I can only imagine how hard it is to be in your situation. I complain about having a zit on my face, when in reality that is nothing compared to what you suffer from. My physical characteristics are very noticeable, as you can see, but I also have hormone defects as well. Tell me about these abnormalities. Well, I was first diagnosed at birth because I had edema of the dorsum of the hands and feet as a result of lymph stasis. This is fairly common in babies with Turner syndrome, as well as neutral thickening first seen on the ultrasound, widely spaced nipples, shortened fourth and fifth fingers, and problems with my heart. However, in some babies with Turner's, these signs and symptoms are fairly minor and they are often not diagnosed until puberty. So how did these abnormalities change during development? Well, during childhood I was short with slow linear growth. I also developed an increased carrying angle of the elbow, a heart-shaped face, and poor spatial perception and visual spatial coordination. Puberty was very difficult for me because I did not develop secondary sex characteristics, have never had a menses, and I cannot have children. In fact, Turner syndrome is the most common cause of primary amenorrhea. I also developed several pigmented moles and the webbing around my neck became loose and distended. You said you have heart problems. What are these problems and are they dangerous? Unfortunately, they are. I have a bicuspid aortic valve which is more prone to stenosis and a coarctation of the aorta. In fact, cardiovascular disease is one of the more common complications of Turner syndrome. Other complications are renal anomalies like a horseshoe kidney, hearing impairment, and hypothyroidism. So what do medical providers do to keep you healthy? Well, to manage short stature they prescribed the growth hormone somatropin when I was 9. Unfortunately, it was not that effective and I am still short. To manage puberty they first prescribed estrogen with progesterone during adolescence and then estrogen-only replacement therapy when I was 15 after I reached maximal growth. I am told that when I am an adult I will go back on estrogen and progesterone to help me with my estrogen deficiency. Clinicians will also closely monitor my cardiovascular problems. If they get worse, surgery could be indicated to correct my bicuspid aortic valve and coarctation of the aorta. They will also closely watch for other common complications like hypothyroidism. So is there a cure? No, there is no cure, but life expectancy is normal as long as we get the medical care we need. What is most important is that people with Turner syndrome accept their disorder and seek medical assistance. Thank you for sharing with me and for being my friend. Thank you for listening and being a good friend.